Welcome. You're listening to the Keeping Ashland Healthy podcast, a podcast production of the Mental Health and Recovery Board of Ashland County, Ohio. Thanks for joining us. Welcome. This is a special edition of Dr. Ashley and the Boss. Welcome, Dr. Ashley.
Good morning. How are you?
I'm doing well this morning. It's cold. If you're in Ashland County today, you'll notice that the snow's flying.
Yes.
And it's wind chill is making things really, really cold. But as I've been told, that's what happens in Ohio when you get to the end of November and December, so I shouldn't complain about that. So we are in a new series about the Mental Health and Recovery Board of Ashland County, and more generally about mental health and recovery boards in Ohio. And we've talked about what boards are and how they're constructed in Revised Code 340. But the next part of the series is getting to know your local Ashland County volunteers that are serving on the board. And I'm so excited because in studio with Dr. Ashley and I is Mary Deeter. Welcome, Mary.
Thank you.
Mary is the current Mental Health and Recovery Board Chair, and we're going to get into several questions. She's going to talk a little bit about what that means to be the board chair, and we just want you as the public and our listening audience to have a better idea, not only what the board does or what the statutory requirements are of boards, but these local folks that are serving, again, they're volunteering and they're serving on your behalf. They're making important decisions every time we have a board meeting that impact all of you. So we wanted to really get, provide an opportunity for you to get to know them better. And we wanted to start with our chair, so that's why we picked Mary to start first in this series. So Dr. Ashley and I will both be asking Mary some probing and hard-hitting questions. No, we tried to find some questions that we think will be easy to answer, but also informative to the listening audience. So are you ready? Are you ready, Mary?
Go ahead.
All right, first question is, how long have you been involved with the Ashland County Mental Health and Recovery Board?
I came on the board in October of 2010.
2010. So for some of you that might be struggling with math, that could be
13 years.
13 years that
Wow.
Mary has been involved with the board. So that's a significant amount of time.
It is,
All right.
and well worth every minute of it.
Well, you're leading me right into my second question. So nobody does anything for 13 years unless they've got some interest and motivation. So tell us in the listening audience, what motivates you to serve on this particular board? Because you could serve and probably have served on a variety of different organizations and boards. Why the Mental Health and Recovery Board?
I have served on a number of different organizations for the last 45 years.
Yeah.
Because I think that what makes a community is people volunteering and their dedication to the community. Mm-hmm. But this in particular, my son is ADHD.
Uh-huh.
And has been receiving services here, and those services aren't going to continue without people volunteering to make these things happen.
So it's personal for you,
Very personal for me.
Okay, yeah. And I think we see this a lot, at least in my experience. Folks that go into the field as counselors, social workers, or other therapists, they usually have a personal tie to the work they're doing. And I think the board members that serve, I think just like Mary said, there tends to be that personal connection to why they're serving. So
It really needs to have a personal connection to make what we do work.
Yeah, no, that's a great point.
Well, you can definitely tell, Mary, that you're passionate for serving on the board, and I've been really thankful to work with you in my time here. I want to ask you to tell us a little bit more about your specific role on the board, and what does that look like?
You have to be able to get along with not only the other board members, but with the general public, because you have to be in tune with what your community is looking for out of the board.
Yeah.
And you have to be able to kind of read between the lines of what they're saying.
Right.
And what changes they're wanting to see made, what additions they're wanting to see, and whether or not that can actually happen.
Right.
Because there's more to it than just saying, I'd like to see this in our community. Do we have the funding for that? Right. Is it something that's sustainable? Is it something we can continue to pay for without stressing other sections of what this board does?
Mm-hmm. Yeah, no, that's a good point. And if folks didn't catch it, Mary is our board chair, so that's her current role. And those terms, we usually do 2 years. Our board chair, if they're willing, and their schedule allows, we usually ask them to serve for 2 years in their officer position, particularly the chair position, just because of the continuity. And I think maybe not with Mary, but with a lot of folks, when they're chairing, it takes about a year to kind of get used to all the responsibilities and the expectations of what a chair is supposed to do. So that first year tends to be a learning year, and then the second year they really hit their stride. So that's why we ask, if at all possible, to have a 2-year commitment for that.
Yeah, you've been doing a great job. And also you were on the finance committee before, and probably others before I was even here.
I'm on the planning and finance
Okay,
committees,
great.
have been the whole 13 years I've been serving.
Really? That's awesome.
Yeah.
Great. The next question is a little bit more of a fun question, and it's one that I really like to ask people. Tell us about the best gift that you ever received and maybe why it was the best.
This is totally a Dr. Ashley question.
I love
Just
this
so you know.
question. Yes.
This was actually the hardest one,
See?
to be honest with you, because how do you remember all the gifts from so many years, you know? But I'm going to have to say it's actually a coffee cup
Coffee cup.
that my stepson gave me back in 1987.
Wow.
And I still use it every single day.
think-
What's this coffee cup like?
That coffee cup's older than Dr. Ashley, I think.
Yes.
It's, I used to drive truck,
Okay.
and it has a wide base on it. He gave it to me because I'm a huge coffee drinker,
Yes.
and it won't tip.
Uh-huh.
Oh, very good.
So it would set while I was driving and not spill my coffee. Now this thing, I'm a klutz. This thing has bounced around my driveway, my asphalt driveway, not a chip in it.
Wow.
It's bounced down the stairs outside,
Wow.
off my deck, not a chip in it. And I still use it every single day. I've
I love
used this
that.
cup every single day since 1987.
It's the same age as me.
Wow.
I love it. That's such a practical, it's interesting to me what people pick for their best gift. So it's a very practical, useful, and it's like made it all these years. So what a great gift.
My husband several times has had to replace the felt that's on the bottom of it.
Still holding up.
That's great. That is a great response. 36-year mug. That's awesome.
Love it. Okay, one more fun question.
All right.
Okay, David, one more
Before
fun
we
one.
get serious again.
Yes. If money were no object and you could go back in time and do anything you wanted with your life, what would that be, Mary?
Wow, time travel.
Yes.
Yeah, I would go back, not a doubt in my mind, I would go back and get my law degree.
Ooh,
Oh,
law degree. Wow.
yeah.
Very cool. What would you do with that?
Help people.
Yeah.
Okay.
It would be, I would specifically do it to be able to help people that cannot afford to be defended.
Okay.
Ah.
I love it. Yeah. I
Yeah.
could see you doing that too.
I can too, and that's interesting because I've listened to other shows and read, and I think we really do have a lack of public defenders. Just because the pay oftentimes is not so good. But everybody's entitled to that defense, and I think folks do it typically for a short period of time, and then they go on to greener pastures. But we really need somebody that's willing to defend those that really don't have a lot of means. They're still entitled to the best possible defense, right? And
I wouldn't do it to be a public defender.
oh,
I would do it as a private practice and just not charge the people that
Wow.
can't
Pro bono.
afford
yeah.
to be defended. Because a lot of times the public defenders are so overwhelmed.
they are. Yeah.
And if you're doing it just out of the kindness of your heart and because you want to help your community, you want to help people that are
Yeah.
disadvantaged.
No, I was just surprised because sometimes when you're grilling me, I felt like you were a prosecuting attorney, when you're asking me questions. So the lawyer thing made sense to me, but the defense side threw me there for a second. So I'm just teasing.
That's hilarious. Yes.
Well, that's awesome. And that does, if you don't know Mary, hopefully you're getting to know Mary, that is very consistent. She's always looking out for those that maybe don't have access to as much means or opportunity. She's always thinking
Yes.
first and foremost about the most vulnerable. And, that comes out even in this question. So, yeah. Well, let me ask you then, maybe a bit more serious, Dr. Ashley. What work of the board do you think most positively impacts Ashland County? So the board funds a lot of programs and services through our contract partners, which right now are Appleseed Community Mental Health, ACADA, and Catholic Charities, the Diocese of Cleveland. But we fund several programs and services through those three partners. But what work of the board do you think most positively impacts Ashland County?
I don't think there's a area I can think of anyways that doesn't positively impact Ashland County, which is one of the reasons I'm still here after 13 years.
Yeah.
But I think it would, in my mind, be the MGM.
Multi-generational mentoring program?
Because we are on all levels at that point. We're helping our seniors, we're helping our youth, and we're helping them to help each other.
Yeah. No, I love that you said that. For our listeners who don't know, the Multi-Generational Mentoring Program is a long-term program that has been funded by the board. Catholic Charities is the organization that implements that program, and it basically pairs some of our at-risk young people with our seniors. It started in the Loudonville area, but it's grown beyond the confines of just the original program. And as Mary, as you said, it's what we call a twofer or a threefer, in that the seniors benefit by their involvement, but also the young people, their families, and I think we've seen ripple effects of how many folks benefit by that. And during the pandemic, what was so interesting, right? It went from an in-person program, and we weren't sure what was going to happen because obviously with those two age groups, our seniors with our young people, there was a lot of risk of perhaps, illness because of COVID and what we thought we knew at the time about how it was transmitted. So it moved into more of a what we call a pen pal situation, or it's a pen pal program where the seniors still stayed in touch with the young people and vice versa, but they were doing it through writing. And that's actually continued to this day, and it's grown. Both the seniors and the young people really like that.
Well, during the pandemic, the seniors didn't feel alone anymore.
Yes. Yeah, that connection.
Because they already had the connection with the youth.
Yep.
And it continued.
Yep.
And they didn't get left behind. And the youth did not get left behind.
Yep.
So our most vulnerable groups were helped even through the pandemic with that.
No, good point. And what we've learned several things, but one of the things we've learned is that, isolation, feeling of alone, it's never good. But the pandemic really brought out how detrimental that can be to our physical as well as our mental and emotional health. So good choice, Mary. I agree.
Yeah, that's a great choice. Connection, so important.
Well, last question for me is, what do you want our listeners to know about the work of the Mental Health and Recovery Board? As I said, the goal of the whole series is hopefully to raise awareness and education in the community about, what the board does and who those members are in our community that serve. But from your perspective, Mary, what would you like the listeners to know about the work of the Mental Health and Recovery Board?
I'd like them to keep in mind that every single member of the board, now, Mental Health and Recovery Board of Ashland County only has 4 staff members.
Yeah.
The rest of it is all volunteers. Every one of these people, every minute that they devote, whether it is a thought process at home, whether it is time that they've spent at meetings, at activities, whatever, they are volunteering their time, their funds for the transport. Everything is on a volunteer basis. None of us get paid for anything that we do.
Yeah.
But our hearts are committed to taking care of Ashland County.
Yep. Well,
there isn't a one of us that is not affected by mental health. I don't care who you are affected by mental health. And what we do helps the community.
Yep. Well, I couldn't agree more. I really appreciate that, and the way you said that. Not everybody knows about the volunteerism that's going on, and that's important to know that everybody's doing it because, as you say, there's really a heart attitude towards this community and serving, and they want things to be better for folks. And we often say mental and emotional health is physical health. I mean, it's really hard to be physically healthy. I would argue, maybe Dr. Ashley, impossible to be physically healthy if your mental and emotional state is not good. So the work of the board does impact, I think, everybody in the community.
I think that was just so well stated, Mary. And I think just in the interactions that I have with board members day to day or like at our board meetings, it's very evident how much all of you care about the community and about mental health. So it's an honor to get to work with you.
Yep.
Thank you.
Mary, thank you for your service.
Thank you.
Thank you,
It's
Mary.
a pleasure.
And thank
Working
you.
with our staff is so enjoyable.
Well, good. See, Dr. Ashley, we're going to keep you.
We have the best staff anybody could ever
Thank you,
have.
Mary. I appreciate you saying
We
that.
have what I call a dream team.
Dream team. Thanks, Mary.
Well, there you have it. Mary Deeter, the current chair of the Mental Health and Recovery Board here in Ashland County. And you've learned just a little bit more about one of our members, but stay tuned. There's going to be a whole series that you're going to get to know some of our officers and other members that serve on the Mental Health and Recovery Board. Thank you for listening to another episode of the Keeping Ashland Healthy podcast. The podcast is a production of the Mental Health and Recovery Board of Ashland County, Ohio. You can reach the board by calling 419-281-3139. Please remember that the board funds a local 24/7 crisis line through Appleseed Community Mental Health Center. It can be reached by calling 419-289-6111. That's 419-289-6111. Until next time, please join us in keeping Ashland healthy.